Selectab is a multivitamin and iron product that is used to treat or prevent vitamin deficiency. This can happen due to a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important for the body and help keep you in good health. It is important to take this medication as directed by your doctor. The daily dosage will depend on your specific needs. It is usually recommended to take Selectab with food to help with absorption. It is best to take it at the same time every day to help you remember. Make sure to follow your doctor's instructions for the best results. Make sure to chew Selectab thoroughly and swallow it once a day as directed by your doctor. It's best to take it on an empty stomach, either an hour before or 2 hours after meals. If it upsets your stomach, you can take it with food. Avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can make it less effective. Remember to take it at the same time every day to get the most benefit from it. If you experience constipation, diarrhea, or upset stomach, these side effects are usually temporary and may go away as your body gets used to Selectab. If these effects persist or worsen, it's important to inform your doctor or pharmacist. Iron in this medication may cause your stools to turn black, but this is not harmful. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While a serious allergic reaction to Selectab is rare, seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, call your doctor for medical advice about side effects. You can also report side effects to the FDA. In Canada, contact your doctor for medical advice and report side effects to Health Canada. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in young children. It is important to keep Selectab out of reach of children at all times. If an overdose does occur, it is crucial to seek medical help immediately or call a poison control center. It is best to take Selectab as directed by your healthcare professional, and to store it in a safe place away from children. Selectab should be taken at the recommended daily dosage and at the optimal timing as advised by your healthcare professional. Before you start taking Selectab, make sure to let your doctor or pharmacist know if you are allergic to any of its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, a history of alcohol use or abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for this deficiency without treating it. Untreated vitamin B12 deficiency can lead to serious nerve problems, so it's important to consult your doctor or pharmacist for more details. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, be sure to consult your doctor or pharmacist before using this medication, as it may contain aspartame. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, make sure to tell your doctor before using this medication, as it may have an impact on your pregnancy. Additionally, if you are breastfeeding, consult your doctor before using this medication, as it may pass into breast milk. When taking Selectab, it's important to be aware of potential interactions with other medications. It's possible that the way your other medications work could be affected, or you may be at a higher risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor first. Some products that may interact with Selectab include chloramphenicol and methyldopa. Additionally, Selectab can decrease the absorption of other drugs like bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as much as possible from your doses of Selectab. Ask your doctor or pharmacist for guidance on how long you should wait between doses and for help creating a dosing schedule that works with all your medications. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs, such as hydantoins like phenytoin. If someone has taken too much Select-AB and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical help by calling 911. Otherwise, contacting a poison control center is crucial. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember to always take medications as directed and keep them out of reach of children. Remember to keep all of your medical and lab appointments while taking Select-AB. It's important to note that Select-AB should not be used as a replacement for a balanced diet. Make sure to continue eating healthy foods to get all the essential vitamins and minerals your body needs. Follow any dietary recommendations given by your doctor to maintain a well-balanced diet. If you are taking Select-AB on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Make sure to store Select-AB at room temperature, away from light and moisture. It's important to keep it in a safe place that's out of reach of children and pets. And when it's expired or no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, don't flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.